Welcome back, everybody, to Injection Insight with Aaron. I'm Aaron, and this is
MJ.
And we are actually continuing our podcast from last. This is the second part of it.
Yeah, we wanted to continue the conversation and take it to the level of what has MJ gotten done, because it's not just the temple filler, but it's also the threads. I took
and the microneedling.
And so, okay. First off, I did tell you I wanted to go slow. So I loved that for the temple filler. Number one, it was no swelling or downtime whatsoever. I went straight out of here and went about my business. It didn't hurt. I didn't bruise. I mean, I know results may vary of different people, but you know, I swell and I bruise and I bleed. So, that's why I wanted to give you props for, I didn't with that. And that's why I'm talking about technique. You must be really good at it.
So the thing about the temples is it's very interesting, and especially radius. So different types of fillers, they respond and react differently. So with calcium hydroxyapatite, which is the radius filler, that tends to swell immediately. So versus the hyaluronic acid fillers like Juvederm and Restylane, of those swell over the course of a couple of days. So knowing that, my knowledge behind it, basically we did two treatments. Remember, we did one and then we came back and did the other, because we didn't want that the swelling to over show too much, because you do have swelling, but you didn't notice it from you because we didn't overdo it. Had we overdone it, you would have like bulging, because it does swell. So we did it in a 2-part series because I did not want you to even realize that you did have swelling, because we didn't want to overdo it. If we had done all of it at once, you wouldn't have been happy. You would have been like, oh my gosh, I'm so swollen. So you didn't even realize you had swelling.
Exactly. And I saw the results right away, but it was subtle. Nobody said like, oh, what did you get done? No matter where I went. And I hang out with nothing but honest people and Persian moms. So that was great, because it was a subtle thing that elevated. Again, it made me just feel so youthful, because when people don't get things done in the right place, or you get something here where you need it somewhere else, I felt like that's what the radius did. And then after you said, if it goes down or when it will go down,
I was certain it was going to, absolutely, because I was going to go down a little bit, which is why we did that second step. And now exactly how it's supposed to look, how it was meant to look. You look refreshed. You don't, what did you mention earlier? You said about the peanut head. Well, you ain't got that.
I ain't got no poor peanut head.
You don't.
And people are like, what is that? So when your temples, when you get older, one of the places where you lose your volume in your face is right here.
So we hollow out in our temples as we age, for sure. Either when you age or when you lose weight.
Peanut head is when you lose fullness in your temples.
Yeah. So as we age, we tend to lose volume in certain areas, and like I had said in previous episodes, that from 25 on, we lose 1% of our collagen every year. So with that being said, we're losing volume in our temples. Every year we're losing volume throughout our body, but in the temples, some people show more than others. Now, that also happens when we lose weight. I know a lot of people are on, GLP-1 medication, or they're working their butts off and trying to lose that weight before summer, whatever it may be, but we tend to lose volume in certain areas, and a lot of people lose it in their temples. So we got to fill that back up. That's don't need to be hollow.
That's what it was so torturing about not having it, is that you've lost weight, you're doing everything you can to look your best, and then there's this area that you don't even think about that is aging you. And it's like, no one ever thinks that the temples is even an area that needs to be hit, because everyone's like so focused on fullness that everyone, like, people are always like complaining about like the laugh, the 11s, the laugh lines, or forehead lines. It's like, well, if you really, that's why, again, I love that you pointed out that such a small amount over 2 visits will be a subtle change. It didn't freak me out or make me nervous. I had no downtime. I was able to carry on and go about my business that day. And then you told me ahead of time that you'll probably come back for a second one. So that's why, like, as the thing settled in, the radius settled in, I then knew, I was like, well, he already told me, like, I can come
You knew
back.
what to
And
expect.
exactly. So that also made me feel good because, Lisa followed up with me after every procedure, and I liked that I could ask questions that she immediately would answer if there was something that I didn't think of in the office.
Yeah.
And then later that day, you come back and you're like, oh, is this what I'm supposed to do? Like, what's the post care again? I forgot, and she was right there with the text or call. And
No,
that's,
she's great.
yeah, it's
And the
really,
thing about with the temple filler, just kind of touching on what we discussed, about the hollowness is, people do, you'll do Botox or neurotoxin on the crow's feet because people have the lines right there, right? But they're neglecting the fact that they have hollowness, right? They had that depletion of volume there. So if you actually add the volume there, you're not only going to get a little mini little brow lift, but you're also going to expand the lines and therefore make you look more refreshed. So you're going to look more refreshed. You're going to look like you slept a lot. Your brows are going to be
yes.
lifted. Like it's all the good things.
I know. That's why I was freaking out in the best way. So the other thing that I did was I have my Achilles heel in life is in my neck. So I told you that the creping in my neck, a lot of women are afraid to even say the word creping and refer to.
It's a touchy word.
It
And even when I
is.
mention it, I'm always on eggshells because it's not the prettiest word, but it's a reality of what it is sometimes.
I don't have any reason why. It's like the creping is there. Why wouldn't I talk about it? It's like it's there whether I want to be in denial about it or not. So I said to you immediately, I was like, this is my thing. It's one of the hardest things about weight loss or getting older or just being a person that has I sort of feel like it comes with posture, it comes with tech neck, it comes with or bad posture or just sort of like being hunched over. So it makes me really self-conscious. And so you explained to me that microneedling is one procedure that, like, can you explain it to me? Like, yes, I got it, but do I totally know what? I mean, first of all, I felt like I looked amazing if I had a red carpet or a wedding or a special occasion or like an anniversary or a vacation. Like, the micro needling is a must.
Yeah, so we did multiple things on next, which we're gonna discuss, right? But we started off with the microneedling, and the reason I wanted to start with the microneedling is because basically we had mentioned before about the collagen, right? We're losing our collagen, and the microneedling, what it does is it's a needle with these little, tiny little needles, and they go and make these little punctures on the skin. And what they're doing is they're stimulating the collagen from underneath. And we obviously put special serums tailored to whatever the treatment is that we're doing, but it basically stimulates the collagen and tightens it. And it's something you do. It's a course, 3 courses, so once a month for 3 months, and it stimulates that collagen. And then you do it annually. But you want to do something like that before you go and do any kind of like PDO threads or anything that's going to be more invasive. Because as of right now, you wouldn't want to do it over threads because you can,
Right.
yeah,
Mess up your threads.
exactly.
Right. And that's why I loved it. You gave us a plan, we had a plan, and we executed. So then the next thing I got was, I was going to say darts.
Darts. Oh no.
So no. So the next thing I said was, Erin, can we please do the threads? I have to say, threads have gotten such a bad rap. I had no intention of getting threads. I thought that the only solution for me was going to go under the knife and get a whole lower facelift. And to be honest, the rapport that I had, the back and forth with the staff of that office, that was the reason why the lower facelift, neck lift didn't happen. I was like, wait a minute, stop. Why does it seem like all the plastic surgeons want to tell you not to do the injectables because what? They're going to get the injectables, they're going to be happy with the results, and they're not going to get the surgery. So I met you and I found out that you are the thread king. And if you are the thread king, and I'm like, there's no way that I'm going to go through all of the downtime of a whole entire facelift, neck lift, lower facelift. No. Why wouldn't I want to try something that's less invasive, that's going to allow me to leave the office and go about my day, pick up my kid from school and go back to work, which I obviously I'm here after because it was like just such a good experience and I'm really really excited about it.
Well, first of all, I just want to say you were an amazing patient. Just the whole overall procedure, you did great. I'm just going to throw that out there. But, when it comes to the threads, the great thing about the threads versus like, obviously I'm not a plastic surgeon or anything like that. I'm a registered nurse, specializing in aesthetics. So I'm not going to speak on facelifts and all of that because that's not my specialty. But my specialty is, the aesthetic, medicine like PDO threads and all of that. And, I could say that it's an amazing procedure that is very minimally invasive. It's less downtime. There's really not much pain involved besides the lidocaine, which you saw. I made sure that I numbed you before we did anything,
Yeah.
and make sure that you were really comfortable. I always joke that clients come and they're like, "Oh my God, it looks so scary," and they tell me that they looked at some video on YouTube or some random video on TikTok, and a lot of that is for shock value. A lot of it really is shock value because
Clickbait.
yes, clickbait, shock bait, and the process of it is very smooth. Half the time you're like laughing and talking to me while, 'cause you don't
Yes.
even realize
I
what's
was.
going on. Yes, because it's not as scary and painful as these videos make it sound. If
So
it's done
true.
properly, obviously.
So true.
Yeah.
So I'll share with you exactly how it went for me. I sat in your chair and you numbed the area. There was a tingle for the lidocaine, but thankfully that was all it was for me. I, had a squishy in my hand so I can focus on, squeezing instead of what was going on. So it was so fast. It was such a quick procedure. I know that you were making one entry point through here and the other through there, right? And so I would say it went by so much faster and quicker. It was pain free. Made one incision on my jawline, on, under my ear, one corner of my jawline, and the other entry point was through the other side. Same thing, right along my jawline. Fast, painless, a lot faster than I expected it to be. A lot painless, which you don't think it is going to be. And then I definitely didn't feel the ones here either.
The smooth threads.
The smooth threads. So can
Yeah.
you tell me about that
Yeah.
one?
So basically, so what we did was we did. You are correct. Obviously, we did one entry point per side on each side of the neck, and we entered put the bidirectional barbed threads, and those are basically they're dissolvable threads that have barbs that hold onto the tissue, and as we're essentially pulling the skin that we're trying to tighten, it holds on, and then we tie them off together, cover it up, and you're good. Now,
Yeah.
we did that on both sides, and then in addition to that, we still wanted to stimulate that collagen. So there's smooth threads, and what the smooth threads do is they basically go under the skin, and they stimulate collagen directly in that spot that we did, and they give you a little bit of an oomph, a little bit of a boost, because they're little smooth threads that are coiled on a small little needle. And the reason I did it after the fact that we did the bidirectional threads is because you were numb. We already did the lidocaine. You didn't feel it because you were so numb. You didn't, you were good. It was like I wanted to make sure that it was done appropriately and in the right steps, so it was less painful for you as the patient.
Yes.
Yeah.
So I am really excited about it because it's just life is too short for us to go through our days not giving ourselves what we need. And honestly, we all work so hard. We, try to stay fit. We try to, be conscious of longevity and quality of life. And at the end of the day, to be very honest, we are putting all this effort in because we want to see that quality of life and that like maximize all of the benefits of all the effort. So I'm just really grateful that we connected because now I know I can call you and say, is this for me? Or what are your thoughts? And I know that if there's some thought that crosses my mind that I can call you guys. You're going to tell me yay, nay, whatever. And, it's just that very straightforward, quick,
For
easy.
me, you will always get the 100% authentic, educated, recommendations based off of your needs, not based off of any other reason. So I think that it's great that we are able to connect that way. And we have, like you said, you followed up with Lisa, and all of that. We have our office number, but we also have our cell phone, and that cell phone is a direct contact from the patients to us with any questions. So especially with threads, there's a lot of questions after the fact. You do leave with you leave with your post care and follow up information, but 2 o'clock in the morning, you're like, I felt something, or I feel something. That's what that number is for. So you can say, hey, I felt this, or hey, is this normal? And we can answer you, and
Right.
we're here for you, just like I would want as a patient. I know that, so that's why
Yeah.
we provide that.
The last thing I have to say is that you told me exactly what's going to happen before and after. You were so on point. You allowed me to be prepared for any downtime ahead of time. A lot of people, they don't tell you what the steps are, and you can feel trapped because
Yeah.
you got something and you're like, wait, you're going to tell me now? It's like death becomes her. She drinks the potion. Now a warning. No, you were so transparent, honest, on point, and I knew that we had a plan. So the fact that I just got this procedure of the threads yesterday, it's been 24 hours, and I'm out. I'm here, and it's like, all I want to do is be able to call you or text you, and having a text relationship with your person is unheard of. I mean, I can text you anytime. You guys made it very clear that if I forgot something or thought of something, and it's anytime, day or night, that I can reach out. And just having that makes us feel good, because when we do get a procedure, we want to make sure that our aftercare is the right thing.
Yeah. No, I mean, nobody wants to feel like they did a procedure and
You're ruining it.
yeah, or like nobody cares anymore because you've already done it. Like that, you want to have that connection, and that's why talking about building that rapport and really building that relationship. That's why we provide that cell phone number to you guys, so that way we can continue continue that. So, all right. Well, first of all, I want to thank you once again for being on the podcast discussing your procedures that we had done. Amazing patient, by the way.
Thank you.
And yeah, I look forward to working with you more in the future. And yeah, so with that being said, I want to thank everybody for watching today's episode. Please make sure that you follow us on all platforms, from YouTube, Instagram, Facebook, TikTok. Feel free to DM us, share our videos, and don't forget to follow MJ at her
Mercedes Javid on all platforms.
Perfect. All right, everybody. Don't forget to use code MJ50, and that's going to give you a special $50 discount on any procedure, any treatment that you would like in our office. So once again, that's MJ50 for $50 off. Just make sure that you call and give that code.
Amazing.
All right.
Yay.